Hello, live from AHA Scientific Sessions 2024. My name is Vaduganathan. I'm an associate editor at JACC and a cardiologist and clinical trialist at Brigham and Women's Hospital. I'm here with senior author, associate professor Ambarish Pandey from UT Southwestern Health System. And we are here to discuss Dr. Pandey's exciting new work from the LookAHEAD trial. So, Ambarish, tell me a little bit about the LookAHEAD trial. You know, overweight and obesity has now been recognized as the core driver of cardio-kidney metabolic health and disease progression. You revisited a prior trial and have new insights that could potentially guide management. So tell us a little bit about the LookAHEAD trial.
Yes, thanks, Muthu, for having me here. So the LookAHEAD trial was actually one of the initial seminal studies that tested the efficacy of intensive lifestyle intervention that focused on weight loss and improving physical activity among individuals with type 2 diabetes and obesity. This was a large trial that enrolled around 5,000 participants, and the primary outcome was MACE outcomes, and overall the primary outcome was null, but individuals had significant weight loss by year 1, and they had regain of some of the weight and by year 4. And when the subsequent analyses were done looking at weight loss and fitness improvement, there were signals for improvement in risk of heart failure and improvement in risk of major adverse cardiovascular outcomes among individuals who sustained weight loss and had significant weight loss by year 1 and year 4. So now that we have got more effective therapies for weight loss in form of newer pharmacotherapies, I think it's really informative to go back and look at the data from LookAHEAD and understand how exactly weight loss can impact risk of adverse cardiovascular outcomes.
And I understand you went back and you reanalyzed data from biomarkers from the LookAHEAD trial as surrogate measures of cardiovascular risk progression.
Yes, so we had actually done a biomarker ancillary study where we got support from the Roche Diagnostics team to measure biomarkers at baseline, 1 year and 4 year follow-up, so that we can understand how biomarkers changed in response to the intervention, as well as in response to weight loss and changes in body composition.
So tell us a little bit about the results. What did you find? What biomarkers did you measure? And what were the trajectories with intensive lifestyle control?
So the two biomarkers that we measured were NT-proBNP, which is a marker of neurohormonal stress and is often elevated in individuals with heart failure or subclinical heart failure as well. And the other biomarker was high-sensitivity cardiac troponin, which is a marker of myocardial injury. So these two biomarkers are very well established as surrogate markers of high risk of adverse cardiovascular events, including heart failure. So we looked at how intensive lifestyle intervention affected NT-proBNP and troponin at 1 year and 4 year follow-up. So for NT-proBNP, we saw that with weight loss and intensive lifestyle intervention, there was a transient increase in the levels of NT-proBNP as compared to the control group at 1 year, and then that increase attenuated by 4 year, such that there was no between group differences in NT-proBNP levels at the 4 year follow-up. However, what was really interesting was differences by body composition changes. So much of the increase in NT-proBNP with weight loss was related to loss of lean body mass. And when we looked at fat mass loss, we saw that by 4 year, loss of fat mass was associated with a decrease in NT-proBNP levels. For troponin, we saw a sustained decrease in the high-sensitivity troponin levels at 1 year and 4 year with intensive lifestyle intervention and weight loss.
It's very, very interesting. And I recall there have been analyses now from the STEP-HFpEF trials as well as the just announced Summit trial that incretin-based therapies appear to decrease the levels of NT-proBNP even in the short term. So are you able to draw comparisons between these two therapeutic approaches to weight loss?
So this is a really interesting, and this is one of the reasons why our findings are more, I think, topical and relevant in the context of findings that are coming out from the STEP-HFpEF and Summit programs. I think the STEP-HFpEF and Summit programs enrolled individuals with elevated NT-proBNP and baseline high levels of NT-proBNP, and then the weight loss that was associated with both lean mass and fat mass changes led to a decline because it caused favorable remodeling of the cardiac structure and function, and that is also reflected in improvement in clinical outcomes in these trials. The LookAHEAD trial is more of an at-risk, a low-risk population where individuals didn't have heart failure at baseline, but had largely much lower levels of NT-proBNP, which was reflected by impact of obesity on NP production. And we know that NP levels are generally lower in individuals without heart failure who are obese. So when we saw the intensive lifestyle intervention take its impact on follow-up, the transient increase in NP was largely related to biological changes in the NP production that has been associated with bariatric surgery as well as other weight loss studies in a generally healthy population without heart failure. But in the long term, we did see that if you maintain weight loss, particularly fat mass loss, you did have a decrease in NT-proBNP levels, suggesting that the fat mass loss may be uniquely beneficial in reducing the neurohormonal stress in the long term.
Fascinating and very important considerations for future lines of work. You can all find out more about Dr. Pandey and his colleagues and co-investigators' work in because this work was simultaneously published in JACC and available online. I hope everyone enjoys the rest of Scientific Sessions 2024.